Good morning. I'm Acting Chief Tim Becker. On behalf of Safety Director Ned Pettis, Jr. and Chief Kim Jacobs, I'd like to welcome you to the Columbus Division of Police Academy to continue this important discussion. Opioid and prescription drug addiction has quickly risen to epidemic level in our country, adversely impacting our communities, including everyone gathered here today. All of us has borne witness to the pain and destruction left in the path of this crisis, which is currently claiming approximately 129 lives per day in our nation. Combating this crisis has proven to be a Herculean task, but first responders have an unyielding passion for overcoming adversity. We all know the starfish story. While today's opioid crisis is a living example of that little boy walking down the beach and throwing the next starfish back into the ocean. Through the continued collaboration, we shall certainly persevere and restore our communities. The Columbus Division of Police would like to thank the U.S. Attorney General for recognizing the severity of this problem in our region and traveling to our city to assist. We are also grateful for all the leaders and dignitaries who have not only gathered here together, but assist us regularly in this battle. Our core values are professionalism, respect, integrity, discipline, and enthusiasm. You saw those words on the wall when you walked into this building. By your presence here today, you are demonstrating each of those core values to help people who cannot help themselves. On your way out, please look at these words on the lobby wall and reflect back to your career as to why you chose public safety. Today, our communities need us more than ever. Please remember this the next time you see a proverbial starfish. Now please join me in welcoming the Mayor of the City of Columbus, Andrew J. Ginther.
Good morning, and thank you, Deputy Chief Becker. We know that Central Ohio is in the middle of an opioid crisis. The people in this room know that better than just about anyone. Our police officers see the effects every day. Just in the first 4 months of this year, Franklin County lost 173 people to overdoses. It's 173 mothers, fathers, sons, daughters, sisters, brothers. That puts this county on pace to see a 66% increase in the number of overdose deaths in 2017. Unintentional drug overdose is now the leading cause of injury-related deaths for Ohioans. The toll on our safety community and the medical community is staggering as the need for treatment and recovery is greater than ever. In June, the Franklin County Commissioners and all of our partners, Sheriff Dallas Baldwin, Chief Jacobs, and leaders from the city, law enforcement, community organizations, put forward a multi-pronged opiate action plan to battle the epidemic with real, tangible solutions and initiatives to help. This plan is a community-wide, evidence-based plan rooted in best practices for results. The plan focuses on 4 overarching goals. Number 1, prevent opiate abuse and addiction. Reduce the number of opiate-related deaths. Expand access and decrease wait time for treatment. And finally, to improve the safety of our community. It's not just a plan. We're already taking action by putting naloxone in the hands of our first responders to provide a bridge to tomorrow. We're saving lives. Now the challenge is, how do we change those lives and make our families and our neighborhoods and our cities and communities stronger? We started the REACT pilot program designed to engage those struggling with addiction in the minutes following an overdose to get them into treatment. And we secured a commitment from our community health partners to add additional beds for treatment. Our plan reaches into every corner of the drug problem in our community. The city, the county, nonprofit agencies, and the private sector are all stepping up to help us put this plan into effect. We call it the Columbus Way, when the public and private sector can work together to channel resources to make a difference in the lives of our people. We believe this plan can be a model for the state and arguably the country. But we cannot win this fight on our own. We must have federal and state support. And we know that every dollar we spend on prevention today saves us $18 in treatment tomorrow. In the 1980s, we saw a politicized, partisan approach to the crack cocaine epidemic and the resulting devastation in urban neighborhoods. We can't let that happen again. I'm asking our partners to step up and be part of the solution. We have to put aside whatever differences we have to address the opioid epidemic and protect our residents. It is now my pleasure to introduce our State Attorney General, Mike DeWine.
Mayor, thank you very much. Mr. Attorney General, thank you for coming.
Thank you.
We really are delighted to have you. The Attorney General and I served on the U.S. Senate Judiciary Committee for 10 years. And we were right next to each other that whole period of time. That's how they do things in Congress, based on seniority. Let me just tell you all that this is a man of great integrity. This is a very good man. This is someone who is just a man of great honor. And so we welcome you. The Attorney General, I've talked about the opiate problem quite a bit, and we just appreciate you being here. I also, Mr. Attorney General, want to thank you for something else that the Department of Justice is doing, and that is you're really concentrating on and telling all U.S. attorneys to concentrate on something that's very important, and that is repeat violent offenders. That is the relatively small number of people that are in every community who are the ones who will commit the violent crime. That, Mr. Attorney General, over a period of time will save a lot of lives in Ohio and other states. It's going to make our cities safer. It's going to make our communities safer. So I just salute you for doing that. That really does, in fact, matter. We did a study a few years ago in the Attorney General's office about violent crime, and we went back and looked at our prison records and BCI records for 40 years. And what we found, I think every law enforcement officer here and prosecutors will, and from your experience that you know, but we have scientific data to show it, and that is our study showed that in Ohio for the last 40 years, 10% of all felons are responsible for 100% of all the violence in the state in the last 40 years, violent crimes. Thank you for focusing on this drug epidemic. There's good news and bad news in Ohio. The bad news is the wave is coming. It continues to come. I don't really see any let-up in it in Ohio. But there is good news, and I think sometimes we forget the good news, but I think our experience in Ohio should be an example for other states. And the good news is, Mr. Attorney General, we have people in virtually every community in the state, because we have this problem in every community in the state, who are stepping up, who are pulling together in many times a grassroots way, almost spontaneously. It's usually led by a mom, sometimes a dad, but frankly, usually a mom who's lost a son or daughter. And they're making a difference. They're changing the culture of that community. And they're pulling business people together. They're bringing the educators together, law enforcement, and they're all working together. And the faith-based community is making a huge difference as well. And law enforcement, as the mayor indicated, law enforcement is doing things today that we never would have thought law enforcement, I'm sure they never thought they would be doing 5 years ago. And that is focusing some attention and energy on getting people into treatment, keeping them in treatment, being their advocates. It's part of the good story, I think, that is in Ohio. And it's part of the story that we want to tell because, frankly, we're seeing people's lives saved every single day. It's now my honor to introduce U.S. Attorney Benjamin Glassman.
Thank you, General DeWine. I agree with a lot of those remarks. The opioid problem is not news to anybody here in the Southern District of Ohio or throughout Ohio. It's something that we have been working on for several years now in terms of prevention, enforcement, and treatment. And it's one of the reasons why I am so pleased to have the Attorney General here today. As I said, we've been working on it for a few years now, working very closely with our federal, state, and local partners. Everybody has an important and irreplaceable role to play in fighting this opioid epidemic. And we've been doing this for several years. And so although administrations change, the mission of the Department of Justice does not change. We are going to represent the United States and advance the interests of the United States zealously, independently, and impartially with the single view of pursuing justice in every matter. And General Sessions understands that. He is himself a former Assistant United States Attorney and United States Attorney before assuming his current role as Attorney General. And I would just like to say thank you for coming to the Southern District of Ohio, for supporting us in our efforts, and for supporting the good work that we are doing here in the Southern District of Ohio and that we intend to do even more of, because I agree with General DeWine that although this is a problem that we're in the midst of, this is a problem that we are going to get our arms around and we are going to prevail. And so it's my great pleasure to have Attorney General Jeff Sessions here today, and I welcome him.
Thank you very much, Ben. It is good to be in Ohio, and thank you for your leadership, 12 years in the Department of Justice. I was U.S. Attorney for 12 years, and that's a few years. I thought it was a long time then, but a lot has happened since. But they've got a great team. I've just been impressed with the spirit and the drive. And you look objectively at the numbers and the accomplishments of the United States Attorney's Office here and all the federal investigative agencies that work with them and all the state and local too, then you see a really finely tuned, effective United States Attorney's Office. And it sets a good example for around the country, the kind of level of professionalism we want to reach. Mike DeWine, it's so good to see you. My best to the family and friend, and 22 grandkids he has, you know. Are they all voters yet? Well, Mike and I did sit together on Judiciary Committee. A lot of exciting things happened over those years, and I've come to admire him as one of the finest public servants I've ever known and worked with. He's decent, courageous, and honest, and the kind of thing we look for in public service. Mike, it's good to be with you. He also had talked to me, actually, you know, before I was confirmed. We talked about the opioid problem here. Also, Rob Portman, you know, is a strong advocate and fully knowledgeable about this issue, and we've talked about it. And the legislation he's been offering, and over the last several years, not just recently, to deal with what we have here, I think is a crisis. Mayor, I like the fact that local officials are taking a leadership role. My own personal view, based on being a United States Attorney in 1981, at the peak of that drug epidemic in the 60s and 70s, not as bad as today in many ways, but it was bad. It didn't have the depth we have today, but it was the grassroots groups the people that came together, worked with the schools and worked with the drug courts. So you got a good drug court system here. I like the drug courts. I helped support one in the 80s in Mobile, Alabama, and it's still functioning. So those kind of things I think do work, and it in the long run, if you can prevent people from starting on this course and they never get addicted, how much better is it? You see these deaths. Treatment won't help them. We've lost them. Many people that go into treatment and come out are still wounded and never really recover from it. Families are broken up. Jobs are lost. College degrees are lost. And anybody says drugs are not an important and dangerous substance aren't in contact with reality. And a big part of our effort and my effort will be to try to encourage people to become active and focused on these issues. Ohio does appear to be, with a number of states, to be at the center of this crisis. On average, one person in Columbus dies of a drug overdose every day. That is an amazing number. But it's not too different from Alabama and other places around the country. That pace is accelerating. According to a survey of Ohio's coroners, more than 4,000 Ohioans died of a drug overdose last year. 4,000. And in Columbus, the coroner has already noted, as the mayor said, a 66% jump this year from last year. So they aren't just numbers. We're talking about moms and dads. These are sisters, brothers, grandchildren. They're neighbors, co-workers. These are friends. These are Americans. Just last week, a 2-year-old girl in Dayton was hospitalized for a suspected opioid overdose, 2 years old. In 2015, across the United States of America, more than 52,000 Americans lost their lives to opioid overdoses, drug overdoses, and the number we have for 2016 shows another increase, a big increase, based on preliminary data. Nearly 60,000 Americans lost their lives to drug overdoses last year in America. This will be the highest drug death toll and the fastest increase in a drug death toll in the history of this republic. This is not a trend we can sustain. It is not acceptable for America. We've never seen anything like this death before. It's more than automobile accidents, more than the AIDS epidemic at its peak, and it's something we can address. It's within our control and our ability to do something about it. This crisis is being driven primarily, as you know, by opioids, prescription drugs, heroin, and synthetic drugs like fentanyl. According to the authoritative New England Journal of Medicine, we're seeing more availability, higher purity, and lower price. Those are three bad trends. When I started, you judged our effectiveness in law enforcement based on three categories: availability, purity, and price. They're lacing heroin and cocaine now with fentanyl, a drug 30 to 50 times more powerful than heroin. As a result, the drugs on the street are now more powerful, more addictive, and more dangerous than ever, and they're not just dangerous for users. Even being accidentally exposed to a few grains of fentanyl can kill a police officer or a paramedic. Sadly, this was almost the case just a couple of months ago in East Liverpool, Ohio, when Officer Chris Green brushed off a few grains of powder from his shirt an hour after a traffic stop, and he fell to the floor. Luckily, he was in his squad room, and they got to him immediately. As the police chief said, quote, "If he would have been alone, he would have been dead." Imagine if he'd gone straight home and gave his hit kids a hug. These are terrifying thoughts for law enforcement. I've seen our law enforcement officers test for fentanyl with full suits on and masks and gloves. This is a dangerous world we're living in. There's no doubt about it, and it's something unprecedented in the history of our country. And so to confront a crisis on this scale, We must take a comprehensive approach to the problem. There are three components, I believe, in an effective strategy: prevention, enforcement, and treatment. Treatment is important. It's critical. In some cases, treatment really breaks the cycle of addiction and crime and can get people's lives back together. But treatment alone is not enough. Treatment does often come too late. By the time many people receive treatment, they, their families, and communities have already suffered. The struggle to overcome addiction can be a long process, as we all know, and it can fail. And not only can it fail, too often it does fail. Most of those of us in law enforcement know the examples of that. So in recent years, some of the government officials in our country, I think, have mistakenly sent mixed messages about the harmfulness of drugs. So let me say, we cannot capitulate intellectually or morally to this kind of rampant drug abuse. We must create a culture that is hostile to drug abuse. We know this can work. It worked in the past for drugs. It has worked for cigarettes and seatbelt. A campaign was mounted. It took time. It became effective. And we need to send that kind of message now. And we need to start that kind of effort now. And I think you already are here in Columbus. The Department of Justice has been working diligently to improve our prevention efforts. We have the drug buyback, take-back drug situation that DEA has hosted, along with their 360 strategy program. Dayton recently was announced as a 2017 DEA 360 drug strategy prevention program. DEA invited me up to New Hampshire, and I stood with, I think, 8,000 high school students. 50 mothers stood before them. All 50 had lost a child to drug overdose. That was really a moving moment for me, and I think hopefully for those young people. Prevention is what we at the Department of Justice do every day, because enforcement is a part of prevention. Enforcing our laws helps keep drugs out of our country, decreases their availability, drives up their price, and reduces their purity and addictiveness. DEA tells us that 80% of heroin addiction starts with prescription drug addiction. And so we've got to stop the abuse of prescription drugs. I am telling you, we intend to do that in the Department of Justice. We're going to work with our Health and Human Services, and we're going to make some things happen here. In fact, as most of you know, we prescribe far more opioids per capita than any nation in the world. Nobody is close. If you take Canada out, nobody is a fraction of where we are. And I think we've got to be careful about that. Things we are doing now. Earlier this month, the department announced the largest healthcare fraud takedown in American history. DOJ coordinated the efforts of more than 1,000 state and federal law enforcement agents to arrest 400 defendants. Over 100 of those were opioid cases. More than 50 of these defendants were doctors, and you've had some of that here. And they have been charged with opioid-related crimes, which means this group was also the largest opioid-related fraud takedown in American history. And just a week after we made that announcement, we announced the seizure and takedown, the elimination of Alpha Bay, the largest dark net marketplace takedown in history. This site hosted some 220,000 drug sale listings. These are people who sell drugs, and they post their prices and availability on this dark web site. 220,000. He was responsible for countless sales of opioid overdoses and synthetics like fentanyl. And we had the example of a 13-year-old who got it from a teenage neighbor in Utah who died from fentanyl being shipped over through that dark net. So these efforts build on the good work of what you're doing here. U.S. Attorney is doing, Benjamin and his department. In January, a doctor from New Albany, Ohio, pled guilty to maintaining a clinic which was a front, really, for drug trafficking. He forfeited more than $29 million, actually received and forfeited by the team at the U.S. Attorney's Office here as a product of illegal drug trafficking, $29 million by a physician. A few months later, in April, a doctor from Portsmouth, Ohio, pled guilty to conspiring to distribute a controlled substance through a pain clinic. For 6 years, the clinic saw more than 20 patients a day who each paid at least $200 in cash. At one point, the defendant even opened her own dispensary at the clinic so she could fill her own prescriptions to the desperate patients. These cases are beginning to roll in all over the country. We had a huge doctor's case in Mobile, Alabama, my hometown, one of the largest in the entire country. They were convicted of racketeering, the RICO statute. So on behalf of the department, I want to say thank you, Benjamin, and your team, and all the investigators, state and local, that helped make these cases possible. You've made the Department of Justice proud, and importantly, you've made the people of Ohio safer, and you've saved lives, I have no doubt. But we can and must do more, which is why today we are announcing a new effort to target our federal resources against this epidemic. If you are a doctor illegally prescribing opioids for profit, or a pharmacist letting these pills walk out the door onto the streets based on prescriptions you know are obtained under false pretenses, we are coming after you. We will reverse these devastating trends with every lawful tool we have. And so first, I'm announcing a new data analytics program, the Opioid Fraud, Abuse, and Detection Unit. I've created this unit to focus specifically on opioid-related healthcare fraud, using data to identify and prosecute key individuals that are contributing to this opioid epidemic. This sort of data analytics team can help us can help tell us important information about prescription opioids, like which physicians are writing opioid prescriptions at the rate that far exceeds their peers. This can be done. We have the capability of doing it, and we're going to do it. It can also tell us how many of a doctor's patients have died within 60 days of an opioid prescription. It can tell us the average age of patients receiving these prescriptions, pharmacies and doctors that are dispensing disproportionately large amounts of opioids, and regional hotspots for opioid issues. With this data in hand, we can identify the abusers much more effectively. And I'm also assigning 12 experienced prosecutors to focus solely on investigating and prosecuting opioid-related healthcare fraud cases in a dozen key locations around the country where we know enforcement will make a difference in turning the tide on this epidemic. These prosecutors, working with the FBI, DEA, HHS, as well as our state and local partners, will help us target and prosecute these doctors, pharmacists, medical providers, and others who are furthering this epidemic while lining their pockets. These prosecutors will be based in several states across the country, including Kentucky, West Virginia, Tennessee, and right here in southern Ohio. This group has proven they know how to effectively use the resources they have, and you have a lot of targets, Ben, that I know you'd like to go to work on. As your chief assistant guaranteed me, Paul, I saw him somewhere here, last night, he will be used, there he is. If we give him this prosecutor, it will be used to prosecute these kind of cases. So with these resources, we'll be better positioned to identify, prosecute, and convict some of the individuals contributing to these thousands of deaths every year. This department is determined to attack this opioid epidemic, and I believe these resources will make a difference. And I issue a plea to our great physicians who we depend on and live with and have friends with every day, dentists and pharmacists. Please, let's slow down on these drugs. First, do no harm. I'm convinced that we can do better and be more careful if we can contain some of the size of the prescriptions that we have out there. And one of the worst things is a bad overdose of prescriptions clearly, scientifically have been proven to lead to heroin addiction, which is a terrible thing. These efforts will make all of us safer, not just from the threat of drug addiction, but also help reduce violence in the community. Drug trafficking has always been an inherently violent business, as our officers around this room, I'm sure, know. If you want to collect a drug debt, you don't file a lawsuit in court. It's collected with the barrel of a gun. By putting traffickers behind bars, reducing the supply of dangerous drugs, we will prevent violence that's often associated with drug dealing. We also have to recognize that most of the heroin, cocaine, methamphetamine, fentanyl in this country got here across our southern border. Almost all of it now is coming across the southern border. Under President Trump's strong leadership, the federal government is finally getting serious about securing our border. Illegal entries are down 50% already, and the wall hadn't even gone up yet. And we don't have the new officers that we'll be adding to. We're serious about this. The American people have asked their country, their government, to create a lawful system of immigration, one that serves the national interest, one we can be proud of. And politicians have ignored that for decades. So this time it's coming to an end, I believe, and we're going to create a lawful system of immigration that serves the country. We admit 1.1 million people a year to lawful residents in the country in a proper way. People need to file their claim, seek their entry, and wait their time. So while we've seen a steep decrease in drug prices on our streets, prices have fallen. Mike told me you can buy a hit of heroin around here for as little as $6 to $10. Told me that December of this year. We were talking about it. And that's low historically, I think, by standards. But the price we as a country have paid for this has gone up. If you ask the economists, they'll tell you that prescription opioid addiction cost our economy some $78 billion a year. And other illicit drugs cost another $193 billion a year. So remember, these drugs often are paid for by private insurance, which we all pay for, Medicaid, Medicare, the VA, we all pay for that. It's out of our pockets. We're making people sick and not well with taxpayers' dollars. That makes no sense. But what's even more devastating is the price we paid in broken relationships, broken families, broken lives, and lost futures and death rates we've never seen before. In the face of the worst drug crisis in our history, we need to use every lawful tool we have, and we will. But I'm convinced that this prescription drug abuse effort is a winnable war. This one we can get our hands around. This one we can make a difference on. We can see prescriptions go down. We can make sure these drug companies are not violating the law and abusing their privileges. And we can stop physicians and others who are improperly prescribing. In order to win this war, we're committing more Department of Justice resources to combat this epidemic, as well as continue to work to strengthen our partnership with you, law enforcement on the front lines. Together, we can and will get it done. You are ultimately the most effective resource we as a country has in this effort. You have a tough job, but it's a job that's important and must be done. And you can know this, you have our thanks, and this Department of Justice will always have your back. Thank you, and God bless.